Yes, indeed. We're talking about keeping your family healthy with the latest on vaccines and concerns about public health. The Partnership to Fight Infectious Disease, which is an advocacy group of patients, experts, and researchers, released a new poll that shows most American voters, regardless of political affiliation, support the continued availability of FDA-approved vaccines. Nearly 3 in 4 American voters believe the U.S. should prioritize ensuring FDA-approved vaccines are widely available for everyone. And nearly 70% of people who responded here expressed concern over declining vaccination rates among children. So this morning, we're really pleased to have Dr. Mrinal Shah here to talk about vaccination, flu, all of that. He's a physician and member of the Columbus Medical Association. I'm glad that you could get up early to come in to talk about this.
Happy to be here.
Very important. So in light of what we just reported, what are you telling your patients who come in to talk about vaccinations?
Yeah, and specifically with the flu vaccine, what we know is taking the vaccine protects you. It doesn't protect you from getting the flu, but it protects you from having a severe case of the flu. Decreases the risk of hospitalizations and definitely decreases the risk of death.
I want to say it's very important what you said. It decreases the risk because people think, oh, I got the flu vaccine and then I got sick. What happens?
If you could compare it to people who didn't get the vaccine, yours is going to be shorter and milder than those who didn't get the vaccine.
It's that simple.
It's that simple.
And so who do you think should be getting the flu vaccine?
Really, everyone can get the flu vaccine. Those that are at higher risk are those that are young and old, and those that have chronic conditions, diabetes, heart disease, heart failure, things like that, chronic conditions where they may have immune problems because of their medications. Those are folks that would benefit from the vaccine.
And so we're in December, no, we're in January. Wow, time's really going. Flu season is October-ish to the spring?
We can see cases as far out as March and April. So yes, we are still right in the middle of it.
So with that said, is it too late to get a flu vaccine?
Not at all. I would highly recommend it. There's still quite a few cases. In fact, this past week we saw the highest number of hospitalizations we've seen so far. So it is not too soon to protect yourself.
And can you talk about the hospitalizations? I mean, when you go to the hospital with flu, you're often in pretty bad shape.
You are pretty sick. You are pretty sick. These are people who are having respiratory problems. So they go to the point where they actually need help breathing. They may be in so much pain and so uncomfortable, headaches and fevers that they need to be in the hospital to be cared for. And the other problem with that is that creates a cascade of processes that might actually make you even sicker with other things. So best thing to do is to stay out of the hospital by keeping yourself safe.
Okay, the worry word of me is now worried about what you're talking about, the cascading problems. What do you mean?
You can have other infections that come from being sick.
Okay.
Then you might get a pneumonia, you might get meningitis, you might get other things that we don't want you to get. So not being in the hospital is always the safest place to be.
Okay, so now when we're at home or when we're in the office, looking at my coworkers, how can we protect ourselves against getting the flu? What should we be doing?
Yeah, no, that's a great question. There are 3 things I always tell patients that they should think about. The first one is always keep your hands clean. And if it's washing your hands with soap and water, if it's using hand sanitizer, whatever it may be, those are great ways to prevent the spread of infection. The second thing I always tell people is if you're sick, stay home. It might be a day or 2 of inconvenience, but everyone will thank you for it. And the third thing I tell people is if you haven't been vaccinated, consider getting the vaccine.
All right. Thank you so much, Dr. Shah, for
You're
coming
welcome.
in. If you feel sick, stay home.